Okay, so again, taking into consideration our discussion for today, it is indeed very important for us to consider some of the common medication safety issues. So with the common medication safety issues, which of the following, actually this the number is to correct, it's 1, 2, 3. So although 1, 2, 2 because it ranked the same response. So this is by ranking. So there is no wrong answers here. However, what could be the common medication safety issues which you think will really affect the condition of our patients? So the number 1 is all about overdosage, underdosage. Number 2 is all about non-reporting of adverse reactions. So we have mentioned about that adverse reactions are being considered when it comes to the untoward reactions of the drug. So still number one is overdosage or underdosage. Second on the rank of the common medication safety issues is on the overload of patient assignments. Number 3, the third in the rank is non-reporting of adverse reactions. Number 4, non-compliance with prescribed medications. So still, you can still cast your response. So still overdosage and underdosage. So with your responses, I may ask our students who may participate and rationalize the response. May I ask Miss Mary Bien, is your connectivity intact? If I may ask.
Hello po. Good
Good
evening, Dean.
evening, Miss Mary
It's
Bien.
raining. Yeah, it's raining po here, so I
Yeah.
might be laggy.
Okay lang naman po. So same here also. So I do understand. So what is your answer among the 4 issues that I have presented that will really affect or may cause harm on patients?
I chose overdosage or underdosage po.
So can you explore or have a brief explanation of why you have chosen overdosage as a major concern when it comes to patient safety?
Yes po. Well, in my opinion lang naman po, especially in our country, sometimes yung and na-experience ko rin po yan since yung family ko po is ganyan. Sometimes yung binibigay po na dosage sa kanila po ng mga physicians is hindi naman din po nila sinusunod. Sometimes po, katulad po ng, i-example ko na lang po yung aunt ko since she's depressed po kasi. And then may binigay po sa kanyang medication yung physician po niya na specific. Tapos po, sa sobrang gusto po niyang gumaling na, she took a lot po. Well, di naman sobra na to the point na na-hospitalize siya. Pero she experienced yung negative side effects nga po ng pag overdose ng medication. Ayun po. Kaya I thought na yun po yung isa sa mga issue in our country and also around the world naman din po. Yun po.
Yes. Siguro there are I definitely agree with you in your situation, and your response is definitely experiential. There's most of the Filipinos during the time of the pandemic, there are the situation goes that they are not consulting the doctors. So sometimes or most of the times they have considered self-medication, which they have considered yun nga yung kanilang perceived dosage that could fit yung situation nila. So with your experience that you have shared, very important din yung guidance whenever there are some situations that an individual is in doubt of the dosage, because really whenever we're doing administration of drugs or medication, this will pertain to a highest priority of safety. So thank you very much. May I ask how about Miss Diokno? Is your connectivity intact? So if ever, if you can respond, this lady.
Good evening po, Dean.
Good evening, lady. What is your response in our survey?
Ano po, yung answer ko po is overdosage or underdosage po.
Okay.
Di ba po, when we are...
Just continue.
when we are administering drugs po kasi, di ba po, is supposed to be right dosage po. Kasi po, pag nag-overdosage po or underdosage po tayo, pwede pong mag-cause yun ng adverse effect or mas malala po is yung toxic effect po. Tsaka po kaya po pag kukuha po tayo ng medication, di ba po dapat po sinasabi po nila wala pong distraction para po tama po yung makuha natin and tama po yung pagkakalculate natin ng gamot. So, ayun po, kaya po overdosage or underdosage kasi po marami pong magiging effect po sa pasyente pag nagkaroon po tayo ng error sa pagkuha po ng medication po.
Okay. So, thank you so much for your response.
Thank you po.
Either overdosage or underdosage can really harm the client because there is some perception that the overdosage is the one that may cause harm other than underdosage. I think it's both kasi if, for example, if the client will experience overdosage, this may cause the possibility that multiple organs will be damaged. This may create, this may lead to toxic effect that may cause harm to the tissues and cells. For the underdosage, the problem with the underdosage is that of, if for example, the client is experiencing sepsis. Sepsis is a medical term that we can associate a severe infection. Then if the client will receive the dose that is not computed accordingly, this will not definitely meet our goal to inhibit the growth of the microorganism. So it is somehow useless. So that's why it's considered underdosage because it did not meet the prescribed dose that could lead to the action of inhibiting the growth of the microorganism. Thus, since the client is receiving underdose drugs, then it will continue the problem with severe infection until it would lead to complications. So, actually, okay, so dun po ba sa non-compliance with prescribed medication, hindi pa magpo-fall sa over-the-counter and underdosage? Okay, so if ever naman po, yung over-the-counter drugs, ano naman to we have the law that facilitates yung kaya sa over-the-counter because it is safe for public consumption. That's why may mga instances, di ba, ang paracetamol, yan, for public consumption, ibuprofen for public consumption na can be purchased in the pharmacy. However, why is it that antibiotics cannot be considered as over-the-counter? So the problem with antibiotics is that of there is an appropriate antibiotic that will target the definite microorganism. So that's why this is even an advocacy coming from the World Health Organization, yung tinatawag nating antimicrobial resistance. If we say antimicrobial resistance, there could be situations that if you will do self-medication such as antibiotics, and if ever your body is already immune to that antibiotic, there could be, because if ever the client is continuously taking those antibiotic, but it is not the right antibiotic that the patient must do or must receive with her condition because there had been no test to consider po that that is the right antibiotic. So that the problem is that of it may cause soon that if this antibiotic is already the one that has been prescribed to treat her condition, there could be situations that yung low level of efficacy of the drug will happen. So yan yung tinatawag natin that the body will become will become resistant na, and these antibiotics will not anymore work for the patient. So that's why be very careful also. So that's why over-the-counter and we have regulated drugs. The regulated drugs that we are talking about is these are the drugs that may need prescription of doctors so that it will consider the safety of the patient, because this may not be a layman understanding that every antibiotic can be just be taken in any condition, because we all know, if you will explore on the drug literature, every antibiotic may target also the specific microorganism. Okay, so I hope I have satisfied your question with my answer. So I will ask two more before we proceed with our lesson for tonight. We have, how about Edison? Edison, are you having a good
po.
connectivity o ang lungkot naman? So,
Di
Mr. Escobar, what is your response here in the common medication safety issues?
Yung ano po din, overload of patient assignments po.
So, what about, can you share with us why you have chosen the overload of patient assignment as one of the medication safety issues?
Ano po din, sa mga public hospital,
Mhm.
marami pong patient yung parang hindi po na ang tawag doon? Hindi
Okay.
po nakakapasok sa hospital dahil po puno na po siya ng mga patient.
Mhm.
Then hindi po sila pwede mapunta sa ibang hospital dahil malalayo po.
Mhm.
So kaya po siya nahahassle sa mga patient na dapat ma-assist habang nandun pa sa mismong hospital.
Okay. So, thank you very much, Mr. Escobar.
Thank you po.
In this situation naman, what Mr. Escobar have shared about the overload of patient assignments, yung medication safety issues because of the full census, the full patient census of the hospital, and those patients may really need administration of medications. There are situations that they may not be attended simply because of the overload, meaning patients may not be attended by the ratio of the manpower. That's why even in any hospital, we are aiming to have the appropriate ratio of one nurse to the specific number of patients. So basically, one of the standards that is based from the DOH Nursing Service Administration Manual is for ambulatory patients, one nurse can tolerate at least yung ambulatory level, not critical level such as ICU, emergency room. So usually they have considered 1:10, 1:6 pagka mga critical level ang patients. But for ambulatory, the patient may have 1:10. But for the overload patient assignments, these are the concerns that somehow may risk a problem with medication administration. To what extent? For example, if the patient administers if the nurse rather administers the medication to the patient, and she need to continuously assess the client for any adverse reactions, sometimes the nurse will just instruct the client to report if there are untoward reactions of the drug. But not all patients may have the confidence to report it, or they may just deny it because there are some situations that they could be hesitant because it may add again to their bills. So because probably it may change the drug, or probably there could be a mindset that it may add another drug. So that's one situation. That's why Filipino nurses are very trained with this situation. Pero somehow we really need to take into consideration na yung capacity of one nurse can monitor a certain number of patients. Kaya when we administer medication to our client, it is definitely our responsibility to monitor if there are adverse reactions. But there are some situations that it may not happen simply because it will just in the form of instruction to either the patients themselves or through the relatives of the patients. Thank you so much, Mr. Escobar. How about I will ask the last student. How about Jermaine? Jermaine Gallio. Jermaine, can you share your answer
Yes.
with us?
Good evening, Dean.
Good
Hello po.
evening.
Ang
Evening.
sinagot ko po dyan ay yung same po kay Edison, which is
Yeah.
yung overload of patient assignment. And sa tingin ko po, isa rin po ito sa common medication issue na maaaring mag-lead into complications sa patient. Siyempre po,
Yeah.
alam po natin yung healthcare workers natin ay tao lang din po. Na-experience rin po nila yung stress, lalo na po pag overloaded na po sila sa patients at workloads, especially po sa public hospitals. Sama
Yeah.
mo na rin po yung halo-halong puyat at pagod. Eh, yung iba
Yeah.
po nag-work ng 8 hours daily and yung iba sumasagad sa 12-hour shift.
Mhm.
Yung iba po, sa tingin ko, nagkakamali na rin sa ginagawa nila or hindi na po nila na-accommodate ng maayos yung ibang patient sa sobrang dami po.
So
Yun
it
po,
seems Sebastian that you are updated with issues of our nurses I'm really glad that you're updated with it kasi those are the situations that really pertains to work environment. So let us take into consideration, as you have mentioned nga, that we are just humans, pero ang nurse pa rin ang mindset niya, there's no reason to commit error. Kasi 'di ba ang mindset natin as nurses is we are dealing with the lives of the people. So pero may mga situations that we have also limitations. So that's why it will be also the responsibility of the hospital administration to see also the welfare of the nurses, because somehow if the nurses will be burned out due to the overload of patient assignments, this may risk also the possibility of medication error. So yun naman yung problem natin. It may not be intentional, pero it may cause a risk for medication error. It may be unintentional, pero it may lead pa rin possibly to a medication error. Thank you so much, Sebastian. So with the number 3 and the number 4, the problem naman with the number 3 is non-reporting of adverse reactions is that of this could be also a major issue. Why? Because if, for example, the nurse or either the patient may not report adverse reactions, example, vaccination. That's why even after each vaccination, you are being observed before you will be released of the vaccination site. Simply because to report also if there are adverse reactions or untoward allergic reactions, any reactions that are unexpectedly manifested. So because these are being reported so that this will facilitate intervention, because the report itself will also gear towards safety of the patient. So that if ever the patient will manifest adverse reactions, then it will consider how the patient will be monitored to prevent complications. The number 4 naman is non-compliance with prescribed medication. This will deal with the perspective of giving alternative. For example, sir, we don't have an antibiotic of cefuroxime. Can we give levofloxacin? So it must be with the thorough discussion of the healthcare team. It may not be on the decision that okay, same classification naman yan of the drug. Two are both antibiotics. But again, it may have a different indication of the health condition. So that could be a non-compliance. So another is with the standards pertaining non-compliance with prescribed medications. If the drug have been given intramuscularly, but it is supposedly given subcutaneous. So yan yung mga concern natin with the non-compliance, and this may lead to a criminal suit of negligence and malpractice if ever. So these are the situations wherein we're considering medication safety issues. Thank you so much everyone for your response. Now, yes, Mr. Richmond, you have a question?
Yes, sir. Ano lang po, sir. Meron na po akong gustong i-share kung okay lang po.
Sure.
Yung po kasi sa part po ng non-reporting of adverse reaction po, I have this experience po this year po, last January, after ko po magpa-vaccination, booster shot po. After ko magpa-booster shot.
Is it the first dose?
Yes, sir.
Okay.
after ko po magpa-booster shot, 1 week after po ay na-experience ko po yung mata ko po para siyang nag-iba po. Like ano, yung pag po tumitingin ako sa pag po nagbabasa ako ng mga letters, pag po nagbabasa ako, yung nagiging watercolor, parang watercolor effect po yung ano ko. So at first po,
If I may ask, this happened within the 24 hours or few days after?
actually sir, few weeks.
Few weeks.
After a week po,
Okay.
after 1 week.
Okay. So
So-
I just want to ask, do you have any pre-existing problem with the eyes?
Wala sir, wala.
Wala. Okay, you may continue.
Yun po. So after po nun, after a week po, so sinabi ko po siya sa parents ko, and then
Mhm.
nung una po hindi ko, kasi medyo hindi ko pa po siya masabi-sabi. Kasi kala ko
Yes.
po baka ano lang baka pagod lang po sa sa
Sa eyes.
online class po. Opo.
Yes,
Eh
oo.
ang naging problem po, first of all po, first time ko po siya na-experience.
Mhm.
Tapos yung so nagpunta po kami sa yung sa gumagawa po ng salamin.
Optometrist?
Optometrist po, yes.
Okay.
Optometrist po una, kasi kala ko po na lumala po na po yung mata ko. So
Okay.
parang yung unang week po, nagpa-check up ako, nagbago po yung grado ng mata ko. Then
Mhm.
after a week po, ganun pa rin po yung nararanasan ko. Nagpa-check up
Mhm.
po ako, nagbago na naman po ulit, which is sabi po ng
Mhm.
optometrist po, hindi po normal yun
Oh, yeah.
sa mata po natin. So
Mata.
nagpunta po kami sa ophthalmologist naman po
Ophthalmologist.
to check po kung ano po meron. Ang
Aha.
naging problem po, wala naman po makita na problem
Okay.
sa mata ko. So
Mhm.
ophthalmologist po suggest na may kailangan akong test kinuha ko po sa MCU hospital po.
Okay.
So lumabas naman po siya,
Mhm.
normal naman po. So
Mhm.
after 1 month po,
Mhm.
yun po yung after a month, parang bumalik po sa normal yung ano ko ulit,
Mhm.
yung mata ko po. So though hindi po natin masabi na effect siya directly by the
Mhm.
booster shot, kasi wala
Yeah.
naman pong study,
Yes.
pero di
Pero
ko
with
po alam.
that kasi you have undergone the series of consultations na eh. So you are looking for a scientific evidence that will direct that okay, it's related to any disorder or any conditions that really affect the eyes. But since you are cleared,
Yes.
have you thought rather after seeking consultation with optometrists that it was related to the vaccine?
Actually sir, opo. Parang
Mhm.
pero for me po actually meron pong fear na nabuo na sa akin na parang siguro kung since meron na pong second booster, 'di ba
Mm.
po? So parang para sa ako po, parang though naniniwala naman po ako sa effect ng
Mhm. Mm.
effect
Mm.
po ng vaccine laban sa COVID. Pero siyempre yung sa naranasan ko po, parang
Yeah.
siguro hanggang first booster muna po ako.
Yeah. So
Yun.
the first and the second dose mo, what's the brand if I may ask?
Sinovac po.
And with the
Booster po,
booster that you
Sinovac din.
received,
Sinovac din po sir.
Sinovac. Okay.
Yes po.
So with that experience, have you realized that supposedly you have reported it?
Yes sir.
Yeah,
Yes
that's
po.
good. So that is really the important that's really the important decision that you may have or for the future nurses, yung importance of why we need to report kasi yun yung binention natin before about pharmacovigilance, yung there is already a pharmacovigilance at yun ay ini-study yung adverse reaction. The vaccines that we are receiving now is still on clinical trial 3. So what do we mean by clinical trial 3? Pag clinical trial 4 kasi, those are the vaccines and the drugs that can be distributed commercially because have attained the maximum level of study that it is safe. For now, That's why we really need to report pa those adverse reactions for documentation. Kasi ang adverse reaction, it may not just only appear 24 hours, days, pwede kasing weeks pwedeng years. Kaya that's why if you will go back to the history of how the vaccines have been approved for commercial distribution and how the vaccine have evolved its approval for clinical trial for, if you will search, it took years because it will lead to the study that if there are adverse reactions that happen to any beneficiaries or recipients of the vaccines from, for example, you have experienced it, Richmond, for after a week ba? After a week?
Oh, yes po, sir. After a week of booster shot.
Booster. So kung after a week of booster shot, kasi yung sa first 2 doses, you have not experienced it, right?
Yes po.
Tapos itong booster rather na first dose, dito mo na experience to. So that's why it's part of the clinical trial or study na may individuals na naka-experience ng visual concerns, ng visual acuity concerns na as an adverse reaction. They may not conclude it yet as adverse reactions, but it is not expected as a response of the body if the patient receives a vaccine. So with that sharing, all of us really learn the importance of reporting. The next question is that, probably, okay, you are now aware of the importance of reporting. To whom naman I will report? Yun naman yung next question. Actually, if ever, may assistance kasi dyan, if ever, you have been considered na lumabas yung adverse reaction na related sa vaccine. So, but it will undergo pa rin a series of tests. So, in this situation, is the next, for example, that the next time that any of you will experience either it's a vaccine or a drug, it is best kung, for example, if you have taken it if you have taken it, if the hospital administered it to you, then most probably report it to the authority who are the nurses and the doctor. But if for the vaccines, then if it is administered by the city health office or your health center, then the report must be cascaded to them because we have the pharmacovigilance report wherein it consolidates the adverse reactions. So thank you, Richmond. Do you want to say pa? Anything pa?
Ayun na, sir. Parang share ko lang po yun para makita natin yung importance of reporting po. Pero
Exactly.
hindi ko po siya sinashare like na para takutin po.
Yes,
Hindi po
yes,
ganun.
exactly. I understand. We understand. Thank you,
Yun lang.
Richmond. Thank you for sharing. Because I hoping others may share also as we go on with our discussion. Kasi these are the things that somehow factors to consider why it is important. I understand that Mr. Richmond have shared it with us not to put scare, not to put anxiety and fear in your mind not to take second dose, but clearly these are experience na it could be isolated He's the one who experienced, pero very important to report. Kasi if ever there are some adverse reaction that happen also to recipients of vaccines, then it must be documented. So siya lang, for example, Richmond reported it, that will help in the study. And you have helped and contributed for the future ng administration of the vaccine because it has been reported na may ganito. Kaya that's why this could be documented and they could be monitored when it comes to after vaccination. They will be asked, do you have any visual acuity concerns and problems? So magiging part na siya ng tool. So ganun yung importance of why you really need to report. It is not just only for your own benefit, but the public will definitely benefit it. So, ano pong naging action doon? Normal daw po ang results, pero meron abnormal na experience. Okay. So, with it comes to normal yung results, pero yung experience. So, we still need to undergo a series of tests so that to validate hindi pwede if we can associate it with the vaccine, but we cannot fully say that it is related to vaccine kasi it will lead pa to the scientific investigation and study. But we could associate it with the tapos the client have clearance, meron pa possibly na test that could be advised so that to identify further other than with the optometrist and the ophthalmologist on the perspective na factors that cause basically the condition. Okay, so thank you very much, Richmond, and thank you for those who are posting their questions in their chat box, hoping the others may, even though we are experiencing thunderstorms. Okay, but anyway, now, when it comes to the stages of drug movement, we'll just go back to some of the basic terms that we have encountered in chemistry, in science. So that's why we have dealt with the pharmacology as the science. That's why we study about chemical composition, properties as well. Now, we have considered diffusion. If we define diffusion, it's the transfer from the higher to the lower concentration. Every drug, every drug, for example, tablet, the concentration is 100%. As it enters the body and proceeds to the stomach, that is still 100%. Once it causes the breakdown, okay, the breakdown of the drug, it just facilitates the breakdown. But once it will proceed to the transfer of breakdown of drugs to the blood to reach the plasma, that's the time wherein we are now considering the higher concentration will consider to lower concentration. Why it will be considered to lower concentration? Kasi it may undergo metabolism eh. Di ba? We have mentioned for every drug that is taken by oral, it may lead to the first pass effect. And what organ facilitates the first pass effect or metabolism? It's the liver. So that's why if there are components, chemical components, or composition of the drug, which is not merely useful for the body, the liver will identify basically those that are not important na, and it will be leading to excretion via the urinary or via the intestinal tract. So that's why we have used yung tinatawag nating diffusion. We have also called the what we call active transport. Sa active transport naman, this is through the use of fluids sa cell. Ayan. So, yung transfer naman, that's why for times that the drug will be distributed sa body, it will be transported via the plasma. And it will be transported to the different compartments of the body. So kung for example, if the drug is indicated to the abdominal organs, we have the peritoneal cavity with the peritoneal fluid. The fluid is the one that transports this drug to the indicated organ. If it is for the brain, we have the cerebrospinal fluid, the fluid that will carry this drug to its indicated cell for action. Another, pericardium. Pericardium is the covering of the heart. It has pericardial fluid. The fluid itself will be the one that will transport this chemical action of the drug to facilitate its desired effect. So that is what we call pinocytosis. If you have any questions, don't be hesitant to post your questions in the chat box. Okay. Now, let us now proceed to the next principle.
Hi, in this tutorial I'm going to talk about the distribution of drugs within body compartments. In the previous tutorial I said that this video would be on the metabolism of drugs, but I've decided that it's probably best to talk about the distribution of drugs before we move on to metabolism. For the purposes of distribution, we can consider that the body is made up of 4 major compartments, which are really collections of fluid, and numerous minor compartments. These major compartments are the blood, or strictly speaking, the plasma, fat, extracellular fluid, and intracellular fluid. Then there are numerous other minor compartments. These include the cerebrospinal fluid, the peritoneum, synovial fluid in joints, and the fetus in pregnancy. There are numerous others, but for the purposes of this tutorial, we'll consider these as one single compartment. So if a drug is placed into one of the compartments, we can see how it might move and distribute into other compartments. Often drugs are placed into the blood. These are drugs which are given intravenously. So when a drug is placed into a compartment, it often associates with binding molecules. These binding molecules are often proteins such as albumin. This process sequesters the drug within the compartment, effectively increasing that compartment's storage capacity. And there is an equilibrium maintained between the bound drug and the unbound drug. The unbound drug within a compartment is then able to move into a new compartment, and thus an equilibrium is maintained between adjacent compartments. When a drug moves into a new compartment, some of that drug is sequestered by binding molecules within that new compartment. This process continues until there is a balance between each compartment and a balance between the amount of...
Okay, I just interrupted the video. We have mentioned, or it was mentioned here, that from the time of, I'll just put this in here. Okay. It was mentioned here at the time that the drug reaches the plasma. That is now the start of distribution and how it will be distributed. I have mentioned about the concept of pinocytosis, right? So through the liquid in the cell, that transports the chemical composition of the drug. So once the drug had been administered, for example, directly to the blood, which is through the intravenous, then it may reach directly to the plasma. Now, how this drug will be distributed accordingly. If the drug is fat soluble or lipid soluble, it's different from water soluble. Ang fat soluble and lipid soluble, mas matagal ang pag-break ng chemical composition niyan. So that's why it will proceed to the fat compartment. Now, if the drug could be either fat or water soluble, it will be distributed to the compartments of the cell. There are two compartments of cell that has fluid: extracellular compartment and the intracellular compartment. Take note of this. It is very important to consider that the transport of drugs through these compartments with fluids, it is very important yung value of the existence na or value of the function of electrolytes. In the extracellular, we have electrolytes that are cation and anion. What do you mean by cation and anion? Positively charged electrolytes and negatively charged electrolytes. So since it is positively charged and negatively charged, it will interact with each other, then it will translate into nerve impulses. And nerve impulses are very important to transfer and distribute the drug. Now, take note of this. In the extracellular fluid or compartment, the highest positively charged electrolyte or cation is sodium. The highest negatively charged anion electrolyte is chloride. Usually, sa cell, pag ang person will be dehydrated, the first fluid that will be out of the cell is obviously extracellular. That's why if you will notice, please check it, if you may have time. If you can check it to any search engine about intravenous fluid preparations, most of the composition is sodium and chloride because it always support the first distribution of drug or electrolytes through this intravenous fluid through the extracellular. So that's why it's sodium and chloride. So if the person will be dehydrated, ang first that will be out of the body and will deteriorate its level is sodium and chloride. So that's why if the person will experience loose bowel movement, frequent urination, so you need to check the sodium and chloride. Moreover, there are also compartment of the cell that will facilitate the distribution, which is the intracellular. The intracellular fluid or compartment has also the positively charged and the negatively charged electrolytes. The positively charged electrolyte for intracellular compartment is potassium, and the negatively charged electrolyte highest is phosphate. So these electrolytes are very important so that it will cause also yung bonding of drugs that will be essential for distribution. Other than that, other than the extracellular compartment of cells and intracellular from the plasma, if the drug is indicated to a specific organ, as what I have mentioned, CSF is cerebrospinal fluid for the cerebral function. Peritoneum, it has the peritoneal fluid that covers abdominal organs. Synovial fluid is the one that could be responsible for the joints. And the fetus may have the amniotic fluid. Moreover, it is mentioned also in this video presentation that we have the what we call the protein bonding. So the protein binding factor. So the protein binding factors such as the albumin is very important so that to facilitate yung pagbond ng chemical composition of the drug and actively transport it to every compartment through these fluids. So let us continue with the video presentation.
When a drug moves into a new compartment, some of that drug is sequestered by binding molecules within that new compartment. This process continues until there is a balance between each compartment and a balance between the amount of free drug versus bound drug within each compartment. The balance between each compartment is determined by a number of factors, and this is best represented using an equilibrium constant. If you've ever done much chemistry, then you'll have definitely seen equilibrium constants before. But if you haven't, then all you need to know is that they are a number which shows whether the balance is in the forward direction or in the back direction. I'm not going to discuss equilibrium constants further here, but I am going to talk about the factors that affect whether drugs would prefer to move into one compartment versus another. Thus, I can say that the equilibrium constant is dependent on
we will not anymore
the
consider
permeability of barriers between compartments, the pH within the compartment,
the details.
the binding
but I will
capacity
explain it.
within the compartment.
Okay. Now, these are the three factors that may affect yung distribution of drug. Permeability of barriers. What do you mean by permeability? Each cellular compartment or organs may have tissues and cells. So if there are factors that may affect permeability, example, alcohol. High level of alcohol in the blood, then you will administer the drug. Will this affect permeability? Yes. High concentration of alcohol could be irritating to the endothelial lining of blood vessels. So on the pathophysiological perspective, once it causes the irritation, it may cause constriction. So, do you think if it will cause constriction, it may cause a delay in the distribution? Basically, the answer is yes. So, another, smoking. the harmful chemicals brought about by the smoke may also have possibility, if the person has lung problem, may lead to the break in the permeability of capillaries and may mix with the plasma. So yung nagke-carry ngayon ng harmful substance coming from the smoke ay si plasma na kasama ng drug. So once it leads to the plasma and goes to the cellular compartments, do you think it will affect the function and metabolism of cells? The answer is yes. That's why harmful siya. At ang cells maapektuhan ang metabolic activity niya. If the cells will affect the metabolic activity, it will not facilitate the distribution. So the second that has been mentioned here is about pH. pH is related to concentration. Kaya if the blood is more acidic or if the blood is more alkalinic, this may affect also the function of the cells. Too much acidity itself may cause premature breakdown of the chemical components of the drug, which may not reach its desired effect. Too much alkalinity as well may have the same concern with that perspective. Binding capacity. So I have mentioned that the binding capacity here is related to the protein. The protein binding capacity such as the albumin. So if there will be a decreased level of the albumin, it will not facilitate the binding of the chemical composition of the drug to be distributed. So this is just simply the one that we are explaining when it comes to distribution. So most probably we will not proceed anymore to this formula, but it just explains merely that for every person, when it comes to distribution, it is always a consideration yung status of the plasma. And the right dose is very important because there could be instances that if you have a problem with liver, na usually ang na-mention ko pa that the common problem with the distribution and may affect the permeability of barriers is smoking and alcohol drinking. So high concentration of alcohol. So and then this will consider basically the concern. So in this situation, this will consider on how a nurse will have the right teaching and right education for patients to really avoid alcohol, avoid some substances that may alter distribution of the drug. So this is more on the distribution. And if we talk about the distribution, in the discussion of the absorption, when the drug enters to any route of administration, intramuscular, parenteral, or enteral, it proceeds across tissues, okay, then enters the plasma. Now, if the drug naman enters na the plasma, dyan na mag-start yung distribution until mag-proceed na siya sa tissues. That's why I have mentioned to you the different concepts of the compartments. Now, this could be affected with several physiologic factors. So what do you mean by physiologic factors? By the body's response that will alter distribution. We have the what we call a BBB, blood-brain barrier. The blood-brain barrier is existing so that to prevent damage of the cerebral tissues. For example, there are some drugs that are toxic. Example, if the client will undergo CT scan and it will inject a dye will be administered intravenously and it will pass through the plasma until the brain. Kaya that's why pag nakita na yung discoloration na pumapasok dun sa monitor, ibig sabihin yun na yung dye na nakamix sa plasma. So pag huminto yan, it stopped to a certain blood vessel, it means that's the one that are blocked. So if there is a problem with the blood-brain barrier, this will cause the possibility that it may affect distribution. So if it will affect basically distribution because the blood-brain barrier is not functioning, then this may cause the possibility of delayed distribution. Sa mga problems naman sa mga highly lipid soluble, so alam naman natin lipid may not be soluble. So ibig sabihin it may not just mix with plasma. So kaya nakikerry yan talaga eh. Unlike for the water soluble, nag-ano talaga yan, mas madali, mas mabilis yung pag-facilitate ng circulation. Pero pag lipid soluble, nandyan lang siya. So pasok siya dun sa fat compartment, distribute, ganun siya. So on this perspective, yung mga highly lipid soluble drugs, there could be a hard time to pass glial cells. Glial cells are in the brain. So that's why yun din yung pwedeng maging limitations on that. So, Din, ask lang po. Ayan, gusto ko yung mga nako-curious eh. Ask ko lang po, na-curious lang po ako if pwedeng magkabali-baliktad yung compartment. Like for example po yung nasa gitna po will intracellular of meron po talaga okay. So, thank you for your question. Actually, it's on the that's why we have the protein binding, yung albumin. Yung albumin ang magdadirect eh. So that's why sabi natin fat soluble pasok sa fat compartment, yung other drugs may pass through na agad sa intracellular, sa extracellular. So basically ang ano niyan, pag pumasok yun sa plasma, cell ang una niyang papasukan. So it's either intracellular, extracellular. So si cell magpapacilitate na yan yung fluid itself kung saan na indicated organ. Kaya that's why yung other compartments related na doon sa kung anong fluid yung distinct doon sa organ na yon. Example, we are giving a drug that will dilate the bronchi. So respiratory system, right? So if it was given intravenously, it reached the plasma. After reaching the plasma, ayan na si protein binding albumin. Pasok pa rin yan sa intracellular, pasok pa rin yan sa extracellular fluid, pero yung distribution dyan, ipapacilitate niya para ma-distribute to the pleural fluid. Ano yung pleural fluid? The pleural fluid is the fluid that had been identified in the lungs. So, yung cell na pinasukan na yun from blood, papasok siya dun sa cell, then it will proceed to the indicated and specific fluids that will carry the action of the drug. Kaya that's why, can you imagine, dinistribute yung drug sa body natin, pero paano niya nata-target na ito pala, ang action nito ay for that? Because that is basically the mechanism that the cell has the major responsibility to direct. Si albumin nagbabind yan, then mag-identify si cell kung anong specific fluid ang magke-carry dun sa indicated organ that will need the specific drug. So that's the wonders of how it considers yung physiologic aspect of the distribution of the drug. So hoping I have responded clearly. So thank you very much. Don't be hesitant in asking those questions kasi very valid siya. So the next question is the next concern on it will affect the physiologic factor is merely on cardiac output. Okay. If you go back to the anatomy and physiology, ang normal cardiac output every minute ay 5,000 ml or 5 liters per minute. Ngayon, we have been oriented na we really need the blood to carry via the plasma the drug. Diba? Yun yung sinabi natin sa systemic circulation. Ngayon, paano po if the patient is anemic? Which obviously, there is a problem with the volume of blood. So, if the volume of blood is insufficient, it may cause also delay in distribution. Because it may not be sufficient yung blood so that to facilitate the peak concentration level to meet the desired effect of the drug. So yun yung limitations. Ano naman, ang isang example naman, kung halimbawa naman sir, paano naman po kung hyperglycemic? elevated glycemic sugar in your blood. So high blood sugar. Pag high blood sugar naman, the problem is that of yung viscosity of the blood is highly compact or highly viscous. So kung highly viscous yan, it causes also the low pacing of circulation. Yung low pacing of circulation sa blood vessels. So eventually, this may cause also the delay in reaching the arterial circulation to distribute to the indicated organ. So that's why there are some situations na if the patient is experiencing anemia, kino-correct muna yung problem with anemia before giving antibiotic because it could be useless. Kaya that's why if you will encounter individuals who are anemic, diabetic, make sure and assess if kung for example anemic yung client, although we have different types of anemia, but certainly its common denominator is low volume of blood. It will really affect yung it will not subject to the objectives ng right pacing of the drug of reaching the peak concentration level, the peak time of the drug that supposedly act in the body. So ikino-correct muna po natin yung blood volume before starting antibiotics or any drug therapy. Next po, body composition. Okay, now, ang concern natin dito sa body composition is that of may problem po ba sa underweight at sa overweight? Lalo na kung obesity. The problem with obesity is slow metabolism. Sa dami ng adipose tissues, that adds to the weight of the client, it leads to the delay metabolic response. Kung nadidelay ngayon yung metabolic response, so eventually nadidelay din yung distribution. And another is kung underweight naman yung pasyente, yung mass of tissues are not sufficient naman para ma-facilitate yung pag-distribute ng drug to the indicated organ or tissues. So that's now the problem. So letter D is blood supply to target tissues. Example, the client is diabetic, has the diabetic wound sa foot, sa paa. So merely, ang isa sa talagang binibigay dyan agad ay antibiotic. Kasi prone talaga sa infection at slow ang healing ng diabetic client. Ang problem natin dito is that of diabetic yung client, kaya delay yung healing ng wound. It's because low yung circulation due to increased blood sugar. So yung increased blood sugar itself, pwede ring nagpo-cause yan ng change in the chemical composition of the drug. Or either it slows yung, because of the viscosity, slow yung pag-transport ng drug and distribution. So that's why we take into consideration then yung aspect na ganon na nagkakaroon pa lang ng situation na nag-start yung diabetic foot or wound, kino-consult na agad ito if it will give na the antibiotic so that it may not spread the infection agad. Kasi yun yung chance na mag-spread yung infection kasi delay yung action dun sa part na yon ng antibiotic. Okay, yeah, it takes time. That's correct, Carl. It takes time because viscous yung blood. Kaya yun yung situation natin na even though the client is giving the antibiotic, pero why is it na nag-lead pa rin siya into the worsening of the diabetic foot? Kasi yun yung limitations niya. Magbibigay tayo ng antibiotic, magsi-circulate yan, pero madidelay naman dun sa mismong site of infection. So merely, when we talk about the degree of vessel constriction and dilation, this is depending on the aspect wherein it will cause the concern when it comes to what cause the constriction of blood vessel and what cause the dilation. So I have mentioned about a while ago that the cause of constriction of blood vessels could be alcohol, could be direct damage to the cell, inflammation, smoke, sample substance of the smoke. So that's why these are the two major concerns that will really affect the drug action. Other than that, yun na yung problema eh. Yung letter X, yung degree which drug binds to plasma proteins such as albumin, ito yung na-mention ko sa inyo. Serum albumin can be tested. So kung mababa ang albumin level or mataas ang albumin level, both may cause a delay in the distribution of drug. So eventually, let us now consider of what metabolism is.
Hi, welcome to the fourth handwritten tutorial on pharmacokinetics. In this tutorial, I'm going to talk about drug metabolism. Drug metabolism often takes place in the liver, but metabolism can take place elsewhere, such as in the lungs or the gut. The fact that most drugs get metabolized by the liver is very important for pharmacokinetics, because drugs given orally may be metabolized by the liver before they reach the systemic circulation. This phenomenon is known as first-pass metabolism. Sometimes first-pass metabolism is so dramatic that it necessitates giving a drug intravenously, as giving it orally would lead to significantly less active drug in the systemic circulation. Morphine is an example of this, which is why it is so often given intravenously rather than orally. However, in this tutorial, I'm going to talk more about the biochemistry of drug metabolism, in particular, the actions of cytochrome P450 enzymes, which are often abbreviated CYP. These cytochrome P450 enzymes are abundant in the liver, and different types metabolize different drugs. For example, CYP1A2 metabolizes caffeine, whereas CYP2E1 metabolizes alcohol. Cytochrome P450 enzymes metabolize drugs through a variety of processes. These include oxidation, hydrolysis, and hydroxylation. So let's have a look at how this works, and I'll try and keep the organic chemistry to a minimum. Here is a drug, and this drug has a hydrogen attached to it. This hydrogen is going to be the target of our cytochrome P450 enzyme. Through the process of hydroxylation, the cytochrome P450 enzyme has turned the hydrogen into a hydroxyl group. But metabolism doesn't stop there. The presence of this new hydroxyl group creates a target for much larger molecules to be attached. There are many enzymes which can act upon this newly formed group. Here we will look at a common one, UDP glucuronyl transferase. Through the action of UDP glucuronyl transferase, a large glucuronic acid group is attached.
Okay, sir. So somehow, too detailed yung discussion ng metabolism. It is just simply as this. Okay, I'll just simplify the presentation of this audiovisual presentation. So we all know for a fact that we have considered the first pass effect as a main function of the liver. Do you know that, for example, since the function of the liver is detoxification, we have specific cytochrome to facilitate detoxification of alcohol. We have cytochrome to detoxify smoke or rather cigarette substance. And we have also cytochrome that will facilitate metabolism of the drugs. Can you imagine that? Those cytochromes are the enzymes that really consider how the liver really functions towards prevention of toxic effect in the body. So if it will cause if you will be engaged continuously into smoking, drug addiction, smoking, drug addiction, alcohol drinking, usually the direct effect is the brain function, and that leads to encephalopathy. So we have the hepatic encephalopathy because the liver cannot anymore manage detoxification, and these toxins is already circulated in the plasma and carried through the brain. That leads a complication. So don't abuse your bodies, don't abuse your health when it comes to this lifestyle modification and control when it comes to alcohol and smoking. Because if ever the liver will be the one that will be damaged, you could be high risk of drug intoxication. Moreover, other than the effect of the liver, it will continue to extend its problem to the kidneys. So that's another concern because toxins may not be out of the body. So the cytochrome 450 is the one that really considers how the drugs takes place on phase 1 and phase 2. The phase 1, oxidation, hydrolysis, and hydroxylation, we will not anymore discuss this further or in details, but moreover, the basic understanding on how the chemical changes happen during the time of metabolism. Can you imagine that the liver separates the chemical component so that it may not cause harm to the body? And which component of the drug had been identified that will be removed out of the body through excretion? So that's the essence of why we do first pass effect for oral medication. So take care of your kidneys and take care of your livers. So I have here responses. So Dean, okay, so one notified to leave earlier. So okay lang po. So Dean, para bang kilak principle po yung cytochrome? Parang meron pong specific enzyme, yung mga na-i-intake sa katawan pero may limit po yung enzymes. Tama po bang pagkakaintindi po? Dean, as lang po bakit nagiging yellowish yung mata pag may problema sa liver? Okay, let's start first with the first one. Yung kilak principle, correct? Kasi for example, kung nagsabay-sabay yan nagsabay, uminom ka ng gamot, nag-i-smoke ka, tapos umiinom ka ng alcohol. Can you imagine na supposedly it's one at a time that will be a focus function of the liver? I-release niya yung enzyme ng cytochrome for the alcohol, cytochrome for the drug, cytochrome for the cigarette smoke. So that's why that's the time that the liver is leading to scarring. Yung scarring kasi yung tissues itself, yung harmful substance hindi na mabalance kasi dapat one at a time kung magsasabay-sabay yung mga cytochrome, it may not manage these 3 cytochromes at the same time. Kaya nagkakaroon ng forceful work demand ang liver. At doon nagpo-cause ng liver cirrhosis. Kaya di ba most common ng liver cirrhosis or scarring ay brought about by the alcohol and by the smoking. So contributing pa yung kung nag-abuse pa ng drug. So you're correct with that perception. So bakit po nagiging yellowish yung mata? Okay, ganito. Ang liver po ay nagpa-facilitate ng regulation of bilirubin. Yung bilirubin po ay bile. At ang bile po is color yellow. So pag ang liver po ay merong damage, such as cirrhosis, such as hepatitis, such as any disorder affecting the liver, why most ng nagmamanifest ay yellowish discoloration sa mata at saka sa skin, or that's what we call jaundice. It's because pag may liver problem, The concern is it will not regulate the level of bilirubin. Kaya that's why nagkakaroon ng hyperbilirubinemia. So ano yung hyperbilirubinemia? Hyper, increase. Bilirubin, yung bile. Imia, sa blood. So kung nasa blood yan at magsisirculate sa body, what happens is that nagkakaroon yan ng shifting from intravascular, ibig sabihin from the blood vessel, magsiship yan sa interstitial space. Pag nagpunta yan sa interstitial space, yung too much bilirubin, di ba yellow siya? Pag mag-ship yan sa space ng tissues, magmamanifest ngayon sa skin kasi lumabas siya out of the blood vessel. So kaya nagkukos siya ng yellowish. Kaya usually yan nag-a-appear sa mga highly vascular area. So that's why mata, di ba highly vascular yan? Kaya nagmamanifest dyan yung tail or yung yellowish kasi highly vascular yan. Sa skin, highly vascular yan. So that's why it causes what we call jaundice. Okay, I hope I have answered the question. So next po, let us now take into consideration that metabolism is this is an alteration of drug from its dosage. Kaya nga sabi ko nga sa inyo, yung dosage form to more water-soluble form. Usually, ang metabolism usually ay nagpa-process ito through liver, plasma, kidneys, or intestinal membranes. O sir, bakit involved sa intestinal membrane? Because there are some drugs that once metabolized, it could be excreted via intestinal tract. That's like, for example, if you are taking iron-based drug, perosulfate, or yung mga iron-based na mga vitamins diyan, usually nagme-metabolize niyan liver, pero the excretion happens after metabolism sa intestinal tract. Kaya observe ninyo ang stool pag nagtitake ng perosulfate, dark colored. Yan, because that facilitates excretion via stool. So pag mga multivitamins naman, the excretion happens during with the kidneys, and that facilitates through the urine. So by plasma, by liver, by kidney, by intestinal membrane. And this usually be affected by genetics. Okay, what do you mean by genetics? For example, a person has an inherited problem related to immune system. So kung may problem siya sa immune system, example, inherited disease ng liver. So obviously, the liver has a major role with first pass effect. So usually yan, pag may mga ganyang problem na, careful yan kasi it may aggravate the situation. So also for the kidneys. Kaya alam nyo po class, careful kayo sa pagtitake ng mga oral medications if it is not prescribed. Lalo na paracetamol. Pag too much ang dose niyan, it may affect liver. So most of the oral drugs are hepatotoxic and nephrotoxic. If it is too much or the use is not according to its prescribed guide. So yung problem. Patient's age and physical condition, so alam naman natin by age, as increasing yung age, bumababa naman yung metabolism o yung physiologic response. So lalo na with physical condition, those who may have problems with certain disorders or diseases, they are rather directly affected with the metabolism. So kung for example yung drug itself, sabi ko nga sa inyo yung fat soluble yung drug. So kung fat soluble yung drug, matagal siyang pang mag-reach dun sa desired effect kasi nga fat soluble. So that's why, although ang fat soluble drug kasi mas less yung effect niya sa gastric irritation compared sa water soluble. So that's why it's very important po sa mga water soluble drugs. Although nabi-break naman siya by easily, Pero these are the drugs na pwede naman madaling mag-irritate sa gastric mucosa. Unlike fat soluble, ito yung hindi naman nagpo-cause ng gastric irritation. So, ito na po yung sinasabi nating first pass effect. So, the first pass effect happens that is usually influenced by oral medication. So, all oral medication. It will pass through the liver, then will metabolize again. Usually, ang first pass effect pag mga higher dosage ng drugs, lalo na sa mga overdose. Yan, yung first pass effect, very, talaga yan, very prominent and distinct yung function itself para ma-prevent yung toxic distribution, yung distribution of toxins. So, usually, almost yung first pass metabolism are happening with the oral administered drug. So, and it is facilitated by the liver. So, next. This could be the last video and the last part of the discussion because we will end the synchronous session at 8 o'clock. So my apology that I have not, I did not facilitate health break. I have continued from 6:20 onwards. So please take your dinner the soonest once we ended our class. Okay. So let us now proceed of what excretion means.
Hi, this tutorial is the 5th in the Pharmacokinetics series. In this video, we'll be discussing excretion of drugs. Excretion is defined as the irreversible removal of drugs from the body. There are two main ways in which the body excretes drugs. One is via the hepatobiliary system. This is when the liver excretes a drug or a drug metabolite into the bile, which in turn gets excreted with the feces. An example of a drug which is primarily excreted by the hepatobiliary system is the antibiotic rifampicin. However, most drugs are primarily excreted by the kidneys. As such, we will focus on this system in this tutorial. In this system of excretion, a drug gets filtered into the nephron of the kidney. If you want more information on the details of this, check out the nephron function tutorial and other kidney tutorials at Handwritten Tutorials.
Okay. Before we continue, I have received a question. Ang vomiting po ba ay form of excretion? Okay. Ang vomiting is a form of preventing toxic effect. Yan. So ano yan? Compensatory so that if for example, if an overdosage of drug, yan, too much, yung higher dose have been taken, the body will respond through vomiting para hindi siya mag-absorb agad, hindi na siya mag-absorb sa intestinal tract. At yung mechanism na yon to be out of the body is through vomiting. So that's why if you notice dun sa mga nag-overdosage, pinipilit silang ipasuka kasi that could be one way para ma-prevent, ma-absorb to ng circulation before it will be distributed sa body at mag-reach sa brain. So the other naman way is kung halimbawa naman siya na for a long period of time talagang na-absorb na, ayan na, dyan na magpa-function si liver through the first pass effect. So eventually there are some situations that will really affect yung induce ng vomiting because it's a compensatory mechanism to prevent the toxic effect. So another question is, speaking of water-soluble drugs, vitamin C overdose can be really induce miscarriage. I know someone who tried, okay, induce abortion by overdosing. Okay, ganito yan. Ang problem kasi with the vitamin C, hindi naman kasi pag nag-overdose ng vitamin C, kasi acid yan, di ba? So ang una talagang magkakaroon ng problema dyan is really your stomach. Kasi nandun si hydrochloric acid, tapos ascorbic acid, for example, pa yung tinake mo. Nag-overdose ka pa. So can you imagine yung high acid to acid combined with each other? That's gastric irritation. Ang problem is, for those who are pregnant na nagkakaroon ng gastric irritation, nag-i-induce kasi yun ng ano eh, nag-i-induce kasi yun ng hormones that will cause uterine contraction. So pag nagko-cause ng uterine contraction, this may lead to the possibility na this may lead to the possibility na mag-lead to premature contraction. So, pero if it may lead to miscarriage, I think it may not, kasi pwedeng mag-contract siya, pero pag nagtuloy yung contraction because of the gastric irritation. So i-ano muna, ang ima-manage diyan yung irritation sa gastric because of brought about by the overdose ng ascorbic. Kasi ipiprevent mo rin yan na ma-absorb sa intestinal tract. Nasama yan sa maternal papuntang fetal circulation. So that may affect also the well-being of the fetus. So somehow, there could be ways para meron tayong mga antidote to prevent yung concern with this overdose. So ititreat muna yung problem with the overdosage or high dosage of the ascorbic acid. But this may not directly associate na mag-lead siya sa miscarriage. Kasi if ever naman yan ma-absorb ng body, si liver pa rin will take part when it comes to detoxification. So I hope I have responded to your question. So referring to the excretion, we have the nephron here. The nephron is the basic unit of the kidney that is responsible for the function. So ano yung function?
First be you.
Okay. Ano yung function ng kidney? So yung function ng kidney, meron tayong nephron, and at the same time, meron tayong ang nephron kasi ang nagta-transmit ng impulses of when is the time that the kidney will release the urine towards the urinary system. So magpa-facilitate the removal of fluid, excess fluid of the body, which also combined doon yung na-metabolize na drug. So in here, we have the tubules of the kidneys. Continue.
From these values, we can determine the clearance of a drug. The clearance of a drug is given by this formula. Clearance equals the concentration of a drug in the urine times the rate at which the urine is being produced divided by the concentration of drug in the plasma. The clearance is often very difficult to understand conceptually, so I'll try to simplify it as best I can. This equation asks, how much plasma contains the amount of drug being cleared at this time? The concentration of the urine times the rate at which urine is being produced shows how much of the drug is being cleared from the body at any given time. This is the top part of the equation. When the bottom part of the equation is factored in, it will give us a volume of plasma per unit time.
Okay. So
Thus,
let's
look at the fact.
We may not anymore consider this formula. However, what is important in this concept is merely on how the drug has been excreted out of the body. The diuresis itself, the diuresis is the process wherein the urine is through the urine, it will facilitate removal of the fluid. And in this consideration, we need to have the glomerulofiltrate rate. The glomerulofiltrate rate will facilitate the processing of the urine and may facilitate it to excrete outside the body. So when it comes to the excretion, so I am now leading to the end of the discussion. The elimination of the drug usually are considered kidneys, the liver, so yon yung bile, sabi ko, via feces, lungs din, kasi yung once exhaled, it may facilitate also the excretion, and breast milk. Kaya that's why, di ba, for those who are breastfeeding mothers or nursing mothers, we take into precaution if the mother is taking drug, kasi pwede siyang ma-excrete via the breast milk. Other minor excretion routes ay saliva, tears, and sweat. So that's why there are some situations, just like for example, di ba? For those who are having high level of alcohol, naamoy nyo through sweat So that's another way kasi of removal excess fluid, excess alcohol. So yung iba nagbabomit. Nagbabomit 'yon kasi there's a compensatory mechanism to facilitate the removal of excess alcohol before it will be absorbed because mataas na yung level. So sa sweat naman, yan, napapacilitate din yan kasi na lumalabas yan via the odor. So eventually, so I think that was the last part of the discussion to end up the pharmacokinetics. So the next topic that we'll discuss is on the pharmacodynamics until we reach the discussion of the other topics that are lined up. So I will end up the recording.